Hi everyone, it's Dr. Cary Yurkiw, and thank you for joining me today as we're talking about posture. It's day 33 of our 100-day journey towards self-improvement. And what we've been working on is reducing pain, improving mobility, improving posture, and enhancing health. And I'll be reading off these slides from our live presentation on YouTube. If you're on Instagram, please follow along. And you might want to go over to at Dr. Cary Yurkiw on YouTube, subscribe to our channel, and like this video as you'll get updates when we're going live. And we try to do this on a regular basis. So today, what we want to talk about is how you can have better posture. And this is part of our focus of less pain, more movement, better posture, and better health. And this is the journey that we're on right now towards improving our patients' health and people in the general public as well. So, regarding posture, we want to talk today about what is good posture and how can you improve your posture if you don't have good posture. And we're going to talk about standing posture. We're going to talk about posture sitting at your desk. We're going to talk about posture in your car when you're sitting in your car, and then posture at work. So we're going to give you some examples today of what good posture is. So for the first point I want to make is standing posture is important because being weight bearing, we want to make sure that the alignment is good so that you're not carrying more weight on one side than the other. So right to left, we want to make sure you have good posture. We want to also make sure your posture front to back is good. And if you're sitting, we want to make sure your back's supported properly, your neck. So we want to talk about all of that. Regarding good posture, the ear, the shoulder, the hip bone on the side, the greater trochanter, and the ankle bone, the lateral malleolus, all four of those postural landmarks should line up from the side. So we want to make sure there's no postural distortion, slouching, like in this picture here on the left, where the back's rounding and the head's forward, because the head is fairly heavy and it'll cause some increased wear and tear on the joints if we have these postural distortions. Sometimes we'll also see things like exaggerated postures or sway backs where there's too much of a curve in a certain area. Here's a slide showing posture at a desk, and what I have here on the far left side is poor posture. So this person is not using their backrest, they're slouching, their head's forward, their back's rounding, and their wrists are not in the right position. So this is very important because more and more people are sitting at desks. We do recommend that you get a desk that can go up and down so it's adaptable so you can stand. And a lot of the recommendations now are saying that standing each hour is really important. So I would switch between standing and sitting throughout your day. I try to switch on an hourly basis. And even if you stand for 10 or 15 minutes and sit for 30 or 45 minutes, that's better than just sitting consistently. So if we look at this picture right here, what we're looking at is the monitor being at the right height, so at eye level. And you want to have about 1 to 2, I would say 2 feet, about 24 inches, 60 centimeters from your eyes to the monitor. So make sure you have the right spacing. Your arms should be relaxed, your forearms parallel to the floor, and you want to minimize any bend in the wrist because if you have too much of a flexion in the wrist, it can cause things like carpal tunnel. So we don't want to see too much distortion in the wrist where it's flexed or extended. The chair should have a good backrest, and I like backrests that go as high up on the back as possible just to support the upper part of the back. If it does have a neck rest, that's great too, just to remind you to sometimes ease back against the headrest or the neck rest. The legs should be parallel to the floor, so we should see the thigh area parallel to the floor, and then a slight bend at the knee. I wouldn't say 90 degrees, but a little bit more open than that, maybe 100, 110 degrees at the knee, so that you have a little bit of a forward movement to the legs. And your feet should be parallel and touching the floor as well. When you stand, your posture should be similar to what we said in the last slide, where we saw the person standing right here with the ear, shoulder, hip, and the ankle lined up. So that's good posture. Okay, so when you're standing, the ear, shoulder, hip, and the ankle should line up. And again, make sure that the head is level with the monitor, and the arms are at the right height as well, based on what we just talked about with the sitting posture. For driving, make sure your head is straight. So we want to have your head looking straight ahead, so you don't have any obstructions. Your arms slightly bent at the elbows, but a comfortable distance so you can easily maneuver the steering wheel. Make sure your backrest is tilted so it supports the majority of the back. So you want contact with the majority of your back. And then your headrest, make sure it's adjusted so that your head can be sitting against the headrest, or if you got into an accident, that there'd be a headrest there to support you and you wouldn't get severe trauma from whiplash. Do not slouch forward and lean forward into the steering wheel. Don't bend your arms too much, so make sure you're not extending too far out or being too scrunched up, because this can cause stress and strain in certain areas of the spine and the body, and you could feel sore and tired after you drive. And I would say, especially for truck drivers, this is very important. For posture at work, make sure you have good alignment of your spine. If you're lifting objects, keep the object as close to your body as possible. Lift with your legs and your hips. When you lift the object, make sure you're lifting straight ahead, you're not twisting, and keep the object as close to your body as possible. And then when you go to put the object down, make sure you're facing the place where you want to deposit the object, and do the same process in reverse. Join me for coffee. We usually do this on Saturday mornings, but this Saturday is going to be Christmas Day. So join me for coffee either this Friday or this Sunday. I'll keep you updated on my social media channels as we get closer. If you have any questions, please PM me. Be happy to answer those questions or write them in the chat here on YouTube. And the last thing I want to tell you about is our social media channels. The social media channels are Instagram, Twitter, Facebook, and YouTube. And we're at Dr. Cary Yurkiw on all those channels. Our podcast is called Super Healthy. It's on Apple and Android. So you can catch that on most podcast providers like Spotify. So just type in Super Healthy and you'll be notified if you subscribe when we're going live with the next video and the next audio. We are accepting new patients. So we're at the Landmark 4 building, and I'll just show you what that looks like here. The Landmark 4 is the middle building between the three. So we're in that center building. The one on the left is Landmark 3. The one on the right is Landmark 5. So we're in Landmark 4. There's lots of parking. You can access the buildings off of Dixon. So I would take Harvey to Birch, and then turn on Birch, and then turn on to Dixon. And then you can come up Dixon to 1628 Dixon. You can park in the central parking area. We're on the main floor on the left-hand side. If you want to book an appointment, click on the show notes below. If you're on social media, click on the link in our bio, and that'll take you to a place where a menu where you can easily book an appointment with us in the clinic. Most new patients, we can see them within 48 hours. We do take insurance, and we do directly bill to insurance, including ICBC for car accidents. And that's a very easy process. We do all the paperwork online and basically text you to confirm your appointment, and then we'll see you at the clinic. So very easy to get into the clinic, for us to do the billings and to start care in Kelowna. So thanks for joining me today. and I look forward to talking to you guys next time. Hi everyone, it's Dr. Cary Yurkiw, and thank you for joining me today as we're talking about posture. It's day 33 of our 100-day journey towards self-improvement. And what we've been working on is reducing pain